Hey Super Mamas, it's Dr. Joy here and you are watching Delivering Joy MD TV. Welcome to Super Mama Sunday. And y'all, today I want to talk to you about something that some of y'all are so embarrassed about. But look, hemorrhoids happen, y'all. It's okay. Let's talk about it. Come on in my office and close that door and let's talk about hemorrhoids, y'all. Make sure you keep watching. All right, Super Mamas. So it really just tickles me so bad to see some of y'all when you're talking about hemorrhoids. And it's always when I'm just about to walk out the door and you like, oh, everything's fine. And I'm like, oh, okay, well, let's go ahead and do what we got to do today and da-da-da-da-da. And we talk about all these different things and you tell me about what you did last week and what happened over the weekend and da-da-da. And then it's like, okay, well, all right, we're going to see you next time. Oh, wait, one more thing. I think I have, hemorrhoids. And I'm like, oh, okay, let's talk about it. Let's figure out what we need to do. So today I want to give you a couple of hacks for hemorrhoids. Hemorrhoids are really just dilated blood vessels that are around the anus and rectum. And it can certainly happen in pregnancy because the pregnancy itself puts tremendous pressure on the pelvic floor. And the rectum and anus are a part of your pelvic floor. In addition, if you are birthing, that can put just unbelievable pressure on the pelvic floor. And the pelvic floor contains the urethra, the hole that you urinate out of, the vagina, and the anus. And so the things that are connected to those, which would be the bladder, the uterus, and the rectum, also have a lot of pressure on them. So we know that when you're pregnant, even just the weight of the pregnancy can cause prolapse with the bladder, can cause prolapse with the uterus, can cause prolapse with the rectum. So pelvic prolapse can be a part of the natural process that our body goes through during pregnancy itself, and certainly a part of what occurs after birthing. So don't be embarrassed about that, y'all. It's a part of the natural process. So anyway, let's get back to some of my favorite hemorrhoid hacks that you can use. So during pregnancy, certainly Tux pads, A&D ointment are certainly easy to grab from the drugstore. You can also use Preparation H, that's over the counter. I tend to really like the ointments better than the creams because sometimes the ointments really help to soothe that area, especially if you need to go to the bathroom. And one of the biggest reasons that people can develop hemorrhoids during the pregnancy is constipation during pregnancy. And if you haven't seen this video that I did on pregnancy safe constipation relief, make sure you check it out. It can be really helpful because if you are having constipation and you are developing hemorrhoids from straining and pushing to try to have a bowel movement, it's not really going to be helpful to treat the hemorrhoids alone if you're not treating the constipation, because that's the cause of the hemorrhoid. So you got to get at the root cause. So if you are really constipated, work on getting rid of that constipation so that you don't just keep, straining to have a bowel movement and creating more hemorrhoids or worsening the hemorrhoids you already have. So you want to definitely work on that constipation, making sure that you're having regular bowel movements, that your bowel movements are soft and easy. So just to hit up the biggest things for making sure that you're having regular, easy bowel movements. The biggest one that I find is water intake. Folks are not drinking enough water out here in these streets. We need you to have at least half a gallon of water a day, and that's the bare minimum. Most times in pregnancy, you need even more water. I tell folks to drink water until your urine looks almost clear. That's how you know when you're well hydrated, particularly in pregnancy. So drink plenty of water. Try to get your 5 to 9 servings of fruits and vegetables. That gives you plenty of fiber so that you can have easy bowel movements. If you need even more help, daily Miralax in pregnancy is totally okay. Also, adding fiber with Benefiber or Metamucil supplement is okay. There are lots of different things you can do. Probiotics, if you know that you already have problems with your digestion or gut health, are totally okay to use in pregnancy, and I think it's actually I think it's a great benefit to add to your supplements when you are pregnant. So a probiotic is great. So lots of different ways you can address constipation in pregnancy. If you have hemorrhoids, make sure you're not constipated, because you will be miserable if you're constipated with hemorrhoids. So we talked about a few of the over-the-counter methods for treating hemorrhoids, and those certainly do work. But now I want to give you a few hacks that I have learned over the years for people who just need a little bit more help. So the first one is witch hazel pops. So witch hazel pops is one of my go-tos. I feel like they have helped many people, and they are really pretty easy to make, and they're inexpensive. So witch hazel pops, all you're gonna do is get yourself a sandwich baggie. You're gonna get yourself a handful of cotton balls, and you're going to throw your cotton balls in the sandwich bag, saturate them with your witch hazel, and pop them in the freezer. Once they're frozen, you're just gonna break off a couple of those cotton balls and tuck them right up against your hemorrhoid. So like right in between the cheeks, and just let them sit there until they have warmed all the way up to body temperature. Once they've warmed up to body temperature, you can toss them in the trash, and you can repeat this as needed. So you can break off 2 more and place those right up against the hemorrhoid. Witch hazel is very soothing to the area, but the fact that it's cold helps to shrink the hemorrhoid. And like we talked about, hemorrhoid is really just a dilated, swollen blood vessel. And so shrinking that can be really helpful with the hemorrhoid symptoms, and that itching, burning sensation, that swelling there. So that witch hazel can be very helpful with that. And then you can take your A&D ointment or your preparation H ointment and just kind of put that there. So using the witch hazel pops in combination with some of your over-the-counter things can really kind of help out with those symptoms. Another hack that I got from one of my general surgery pals is rectal rockets. I know it sounds crazy, doesn't it? Rectal rockets. And these are suppositories. And suppositories are like these small pills that you can place right up into the rectum, and they dissolve, and there's medicine inside of those. Rectal rockets are a compounded medication, and that just means that it's a medication that a special pharmacy prepares for you. So it has several different ingredients in it. And with pregnancy, we're always pretty careful with using a particular class of medications called non-steroidal anti-inflammatory drugs, or NSAIDs. And you can use a short course of NSAIDs in pregnancy, but you want to be careful about regular use. So for the rectal rockets, I'm sometimes cautious depending on how far along in pregnancy someone is, but I will use these ingredients, and I'm putting them here. So if you want to screenshot it and share it with your OB care provider, if you feel like your hemorrhoids are off the chain and you really need some help, these are the ingredients that I use in them. But these rectal rockets really work well, and you only need them for 3 days. So you use 1 rectal rocket every day for 3 days. And everybody so far that I have tried these with definitely has gotten some relief. And if you are in your 3rd trimester, I recommend leaving the baclofen out. But even without the baclofen in it, people have still gotten really good relief. And the other medications that are in this recipe are well tolerated in pregnancy and safe. So if you really are having some serious hemorrhoids and you're miserable and you've tried everything over the counter, this might be something that you can discuss with your OB care team that can really help you out a lot. Of course, If you sustained some hemorrhoids when you were birthing and you've got some real serious hemorrhoids, because I have seen hemorrhoids get very, very large, you may need rectal rockets or other medications to help, but surgery might be necessary. So if you are not really able to control your hemorrhoids with some of the over-counter preparations or some of the prescription medications that are available, you may need to be referred to a general surgeon. So if you have tried all of the hacks and all of the over-the-counter stuff and you've seen your OB care team and they've given you some prescriptions for things like lidocaine jelly or some of the preparations that are available at compounding pharmacies, you've used all the sprays and all the creams and all the ointments, it may be time to seek a referral to a general surgeon who might be able to take a look at your hemorrhoids, especially if they're bleeding or if they're clotted off. You can have hemorrhoids that are thrombosed, and those are usually very, very painful. So so if your hemorrhoids are really, really causing you a problem, it's time to speak up about them. Don't be embarrassed. So I hope today's video was helpful. Make sure that you speak up if you're having problems with your hemorrhoids. If you learned something today, give this video a thumbs up. Make sure that you subscribe so you don't miss a single Super Mama Sunday. And I will catch you next Sunday. Peace.